Is my information confidential? And will you need to tell my GP? Are you looking for reassurance that your private therapy conversations stay that way? Or are you merely curious about how we record, store, or share your information? In this video, I'll tell you how confidentiality works in counselling, showing you what to expect, and addressing any concerns. For all psychologists, therapists, and counsellors, our professional codes stipulate that we need to keep up-to-date and accurate records of your treatment. As well as storing your contact information, we also keep session notes and questionnaires you complete. We store your information digitally using high-grade encrypted software that complies with recommended security standards. Your information is stored in the cloud, not on local computers, giving you additional protection. And we only use approved systems for keeping your data because we can't be sure that generic systems are secure. Our emails and documents are sent to you securely from our practice management systems or organizational email accounts. We do not use personal accounts for correspondence. We use third-party apps to provide additional services for conducting video sessions or sending newsletters. Again, your information is kept secure. Video sessions are conducted using high security encryption, that's HIPAA compliant, which basically means that we follow the legal requirements for healthcare organizations, which protect your information. GDPR and UK data protection laws guide us on how to look after your information. We are registered as a data controller with the Information Commissioner's Office, or ICO, and this is a legal requirement for any person or organisation that processes personal information. All your information remains private and confidential. We do not discuss you or anyone or share your information. There are several exceptions, including the risk of harm, child protection, vulnerable adults, Terrorism Act, drug trafficking, money laundering, court orders, and public interest. When it comes to the risk of harm, if you tell us an intention or plan to cause harm to yourself or others, we do have a duty to take steps to prevent that harm. And this might involve informing relevant authorities, mental health services, or others at risk. When it comes to child protection, if your therapist believes a child is at risk of harm or abuse, then they're legally obligated to report this to the appropriate child protection services. And this is in line with the Children Act 1989 and 2004. With vulnerable adults, it's similar to child protection. If a therapist believes a vulnerable adult is at risk of harm or abuse, then they have to report this to the relevant authorities. With regards to the Terrorism Act, therapists are legally required to disclose any information they receive about acts of terrorism or potential acts of terrorism. And then when it comes to drug trafficking, under the Drug Trafficking Act 1994, therapists have to report any knowledge or suspicion of drug trafficking. And with money laundering, the Proceeds of Crime Act 2002 requires professionals, including therapists, to report suspicions of money laundering. When it comes to court orders, therapists may be required to disclose information if they receive a court order. This could be in the context of a criminal investigation, a custody battle, or other legal proceedings. And then with public interest, and this is in rare cases, there might be an overwhelming public interest in disclosing information, even if it breaches confidentiality. This would be in situations where the wider public is at risk, of course. All therapists discuss their cases with a supervisor or expert clinician. It's important to ensure that you get the best possible interventions and care. However, we only discuss the work, not your personal information, and supervisors are bound by the laws and codes of conduct the same as therapists. If you have an insurer or third party paying for your sessions, we only share the bare minimum of information. They may request updates on your treatment, and these are brief summaries only. We are required to keep your information for 7 years. After that, we delete it. You can request a copy of your data, however, we cannot delete it before the 7-year period has ended. We have a quiet, professional, comfortable space to work together, undisturbed, to ensure your privacy during sessions. When working online, your therapist will ensure that they are in a private location, and we advise you to do the same. We do not request GP details, and we do not contact them routinely. If you are prescribed psychoactive medication, such as SSRIs, benzodiazepines, or antipsychotic drugs, then we would require your GP information. We do ask for an emergency contact, such as a family member or friend that we can contact should the need arise. So as you can tell, we implement several measures to protect your information and maintain confidentiality. We only share information under exceptional circumstances, which in our experience rarely happens. If you have any questions about confidentiality, please get in touch.